All right, Kevin, we are ready to go.
All right, very good. Good morning, everybody. Welcome to the June 1st, 2022 meeting of the Health and Wellness Committee. I hope everybody had a good long weekend. Of course, a weekend where we express our gratitude for those who gave their lives for our freedom. And this week is, of course, the first week of June. Some people refer to that as the unofficial start of summer, and as John Mayer saying, a little bit of summer is what the whole year is all about, and I'm looking forward to it, and I hope you are too. So I'd like to move to approve the minutes for the month of May. Can I get a motion for that, please?
We're going to defer those.
Oh, that's right. I'm sorry, Paul. I jumped right in. I apologize. That's right. So we're going to defer those. So we'll jump right into our community highlight. We've got Nick Osborne with Low Country Food Bank, and he also has Alicia Haza with us. And so I'm going to turn it over to Nick now, if you would, Nick. Thank you.
Great, thanks very much indeed. I really appreciate it. And Paul, thanks ever so much for giving us this opportunity as well. Paul, are both Alicia and I able to share screens? Does that work, Paul?
It's up, Nick. You can see it.
Great.
Perfect.
Brilliant. Well, thanks ever so much, as I said. So I'm joined by Alicia, and Alicia is our Director of Equitable Access and Produce Initiatives. Bit of a title, but anyway, Alicia's key in a lot of the work that we do, and Alicia and I will share the presentations. I'm going to give a fairly quick run through in terms of who we are and what we do at the Low Country Food Bank. And then Alicia is going to take us through the work that we've been doing over just over the last year in terms of looking at the use of data and technology around some of the work that we've been doing to map our service area and how that is helping inform some of the issues and challenges and needs related to hunger and food insecurity, as well as other issues as well, and how that has been instrumental in terms of informing a lot of our decision making and a lot of the work that we do. And I think hopefully dovetails quite a bit in terms of some of the work that Paul, I know you presented during the last meeting, but also in the past as well, where I think increasingly a lot of us are using GIS technology and mapping to help inform both an understanding of our service areas, but also what's the most appropriate way to respond. So just to start with, I like to put this one up here, and I know this is a slide that I'm sure resonates very clearly with everyone on the call today, and I don't need to spend too much time on this, but I think it's an important point to make that hunger and food insecurity has a multitude of different faces, and I think there is very often a sort of a stereotypical sense of what someone who faces hunger and food security may look like. But in fact, what we see, and I'm sure as everyone is very fully aware, hunger and food insecurity, along with many other challenges and issues that our communities face, can affect anyone at any time. It's not just someone that doesn't have a job or someone that is unhoused. It can be someone that is fully employed, but is employed on minimum wage, but has huge amounts of stress on their lives in terms of things like childcare, and is struggling to make ends meet and therefore needs support in terms of food. It could be someone that has faced a medical problem, a shock or a stress or an unexpected expenditure in their lives, and therefore has to rely on support at a certain point in time. So as I said, hunger and food insecurity can impact and affect any of us at any time. And I think, obviously, as we all know, having gone through the COVID pandemic, we've seen the incredible uptake in terms of those that have needed support. Certainly in some of the work that we've been doing, some of the survey work that we did during the pandemic, we found that 50% of people that were seeking assistance at our drive-through distributions were first-time recipients of food. So again, it just shows the enormity of the challenges and issues that many members of our community face, both on a long-term basis, but also on a one-off basis, if and when they're faced with a challenge. So very simply, what is food insecurity? We define food insecurity simply as the lack of consistent access to enough food by everyone in a family to lead healthy and active lives. It's a definition that is used quite universally across the Feeding America network that we're part of, but one that we are consistently seeking to address. So a little bit about the Low Country Food Bank, and I'm sure many of you are already very much aware of this, but we work across the 10 coastal counties of South Carolina, from Horry County right down to Jasper and Hampton. And of course, those coastal counties vary significantly in terms of issues associated with hunger and food insecurity. And as a result of that, a lot of the work that we do is very much adapting to those different contexts. And I think certainly over the last 2 years, we've seen tremendous differences across the counties as the pandemic has impacted those communities in very different ways, whether that be a community in Horry, which is traditionally dependent on the hospitality business and how that has, how COVID has impacted that, to some of the most rural areas where we work in the Williamsburg, for example, or down in Hampton, where we've seen how COVID has impacted on very much rural-based poverty as well. So our vision is simply one of ending hunger in coastal South Carolina, with a mission to lead the fight against hunger throughout the 10 coastal counties of South Carolina. We have three guiding principles that support the work that we do. Obviously, we are looking to, one of our principles is obviously to feed those communities and those neighbors that are hungry and food insecure. But importantly, and these three guiding principles, I look at these three guiding principles as principles that don't sit in isolation. They work together, are very supportive of each other. So whilst we are seeking to feed and support neighbors that are hungry and food insecure, we're also at the same time using the knowledge and the experience that we and our partners have to advocate for those in need of food and who find themselves hungry and food insecure. We don't do that alone. We do that in partnership and in collaboration with others at various levels, whether that be at the local level, the state level, or also at the national level as well. Then importantly, the third principle is one of empowering. We're seeking to empower our communities and the neighbors that need support, again, in partnership with others, in order for those neighbors who are facing issues and problems with food insecurity to be able to get back into a sense of sustainability, build resilience, and to be able to address their hunger and food insecurity needs in the future. And a lot of that is focusing around awareness and training and support around the nutritional elements of hunger and food insecurity, to enable people to our neighbors to make better choices in terms of nutrition, to be able to look at and identify alternative sources of food that enable them to once again become sustainable moving forward. It's we often find it quite, or I certainly find it quite challenging trying to explain the extent, the depth and breadth of everything that we do. So this diagram here is an attempt to try and boil it down into as simple form as possible in terms of explaining the way that we work, both in terms of the sources of support that we receive, both in terms of food, but also other funding that we receive as well. So you can see on the left-hand side here, we receive support from a number of different sources. So importantly, we do receive a significant amount of food from retail. I think approximately around about 30% of the food that we receive comes from the retail stores, from the Walmarts, from the Harris Teeters, the Publix. We receive food, obviously, we receive support from the government, both in terms of food and funding as well. We also have very close relationships and look at establishing relationships with our local growers as well, but also growers outside of our area as well, but really a focus on our local growers in terms of how we can offer win-win situations to help support economically our growers in our service area, to enable them to remain economically viable by purchasing food from those growers, which of course we are then able to distribute. We have food drives. We get some support from manufacturers, probably less so from manufacturers than many other food banks do, because of the area that we are in here in the coastal area of South Carolina. So we don't have such high level of access to manufacturers as perhaps some other food banks have that are more centrally located. And of course, we receive quite a significant amount of our revenue through a variety of different donations, whether that be from the general public, whether that be from foundations, corporates, but obviously all of that comes together, is collected and is sorted in various different ways, and is then distributed out through a variety of different programs that we have. So we provide support to our neighbours in very different ways. Of course, during the last 2 years through COVID, we've had to adapt a lot of that support that we would have provided more traditionally. And of course, the drive-through distributions have were a predominant feature over the last 2 years, given COVID. But slowly we are moving back to providing support at distributions that allow more market-style client choice, with the introduction with the access to fresh produce and dry goods as well, but in a much more of a market style. Again, a lot of our work is very much focused on ensuring the dignity of those that require support. Importantly, in the middle there, I should have picked this up first perhaps, is our food pantries. We couldn't do the work that we do without the partnership and relationships that we have with our food pantries across the 10 counties. We work in partnership with around about 255 food pantries across our 10 county area. And those 255 food pantries probably distribute somewhere in the region of about 90% of the food that we receive. So it's an enormous amount of food and support to communities and neighbours being provided by food pantries. So a lot of the work that we're doing is about building capacity, looking at how we can improve the infrastructure and support that those food pantries are providing. Those are food pantries that don't, in a lot of cases, don't just provide food, they provide a whole range of other support and services to communities as well, whether that be information related to access to health, access to employment opportunities. So again, those food pantries are an essential part of our work and a real focus for us as we look at different models and ways in which we can continue to build that capacity, because at the end of the day, those food pantries are the ones that are closest to our neighbours, that have greatest touch to the communities that we serve, and are there to serve in the most appropriate way. A lot of our work is through school programs. We have a lot of different school programs working in close coordination with the schools in terms of, especially with a lot of our nutrition programs, but also in terms of school markets and school pantries as well. We do a lot of on-site meal programs as well. We have a full production kitchen here at our facility, which we're able to create incredibly nutritious meals that are attractive, but also are incredibly nutritious to our neighbours who need support and who need meals. And obviously, a lot of our focus is not just with children, but with veterans, our veteran programs, our senior programs. But also over the last, I guess, year and a half, we're also looking at our relationship and partnership with clinics in terms of looking at our food for health initiatives. So those members of the communities that are being screened as being food insecure, how can we then support them with emergency support, but also then connecting them with with nearby pantries where they can get more sustained and longer term food support, so that they are able to move from being food insecure to becoming healthy and more productive. Because very often if someone is seeking health and is in need of health, that can very often be as a last resort. So it's really important that we're able to identify and target those neighbors that find themselves in those situations. So that's an attempt at trying to explain in a very quick and high level way a lot of the work we do. And I know I've missed quite a bit out of there because we have a variety of different programs under each of these. I mean, especially with our school, our children's, our backpack buddies programs. For example, our kids cafe, our summer meals, for example. So there's a whole range of approaches that we do, but all of these, and we'll come to a little bit more because when Alicia talks a bit about the mapping, a lot of our understanding about the context and where we work helps us direct in the most effective way, the most appropriate program. Here is just a high level snapshot of our impact in 2021. So we distributed a total of 40.7 million pounds of food. I don't know about others on the call, but often when I see figures like that, it leaves me a bit confused, because what does 40.7 million pounds of food look like? So I tried to sort of work this out this morning. And if you can imagine a line of trucks backed up again, they're behind each other, that would be a line of trucks that stretches back 16 miles. So it gives you a sense of the amount of food that we're distributing to those neighbors in need. That provides the equivalent of about 34 million meals. As you see here, a large proportion, so 36% of the total distribution is fresh produce. And this is an initiative, this is something that we have focused on as a major strategy for us over the last few years, to really increase the amount of fresh produce that we're able to both source, but also be able to put into the houses of our neighbors in need, because of the importance and the nutritional value of fresh produce. So we're on an annual basis, we're targeting or able to support around about 200,000 food insecure children, seniors, and families. Importantly as well, given the sourcing of food and where we're able to source food, that would have in many cases be food that would, if we're not able to rescue that, which is food that is still very much available to be able to be provided to neighbors in need. If we weren't being able to take that and source that and provide that and distribute, that would have otherwise been food that may well have gone to waste and ended up in various dumps. So that's equivalent to about 15.3 million pounds. So again, you could also look at that from an environmental context as well, and the rescuing of that food that otherwise would have been ended up in as waste. 96% of any of the funding that we receive goes directly into our programs and services, and that's a key metric that we use to monitor the efficiency and the effectiveness of the programming that we do. So all of that being said, how do we achieve our impact? And as coming back now to the role and the importance of data, and especially in the last couple of years and since 2020, where we introduced GIS mapping technology into the work that we do, that has been able to develop and evolve our ability to both identify the needs and to develop appropriate responses in a variety of different ways. And we are continuing to invest in the use of data and GIS technology to continue to improve the efficiency and the effectiveness of the work that we do. So, and I think we've all heard this before in some of the other presentations that we've heard over recent months around the use of mapping, but obviously it helps us be more effective in our ability to identify gaps in access to food, but also then helps us target those priority areas of greatest need across those 10 coastal counties where we work, which again is going to change from time to time as well. So it enables us to track the trends, to monitor those trends over time, and to be able to respond to those trends in a very proactive rather than reactive way, which feeds into a lot of the decision making that we make. It also enables us to set some equitable targets and establish accountability for those levels of service that we're providing across counties. It could be very easy for us to talk about achieving a target of £40 million a year, but that £40 million of food that we're distributing gets distributed to some very remote areas across many of our service areas, which of course is something that we have to plan, and the logistics around are incredibly complex and challenging, but that's important in our ability to meet those neighbours where they are. And that helps us create innovative ways of identifying where those gaps are and how we fill those gaps. And we're continuing to evolve alternative distribution models and approaches. Again, this is all being informed by data and our ability to map and see the picture of need across our service area. So I'm going to stop there. So I probably went on a bit longer than I should have done, but I'm going to hand over now to Alicia to give now a bit of context and show to you how we're using the GIS mapping and how this all comes together and bring it to life a bit.
Wonderful. Thank you, Nick. So again, my name is Alicia Healtha. I am the Director of Equitable Access and Produce Initiatives, as Nick mentioned. I'm going to go ahead and share my screen. And if y'all can just give me the thumbs up, if you can see it.
That's there, Alicia, yeah.
Okay, perfect. Sometimes I am not very tech savvy, believe it or not. As the person that does the mapping, I struggle. Not with the map though. So as you can see here, I zoomed in a bit. So we have got some of the corners of our service area are kind of cut off, but this should resemble the map that Nick pulled up a few minutes ago of the 10 counties that we serve along the coast of the state. And this first layer I'm going to pull up is a map of all of the locations where food access was provided in the previous rolling 4 quarters of the year, so the past year, if you will. So we've got a key here on the left-hand side of the different partnerships that are represented. They're a little bit varied, but there's an example of these red pins are our 3 facilities. I can just toggle that one on by itself. These are our 3 facilities. Our biggest facility is in Charleston. It's about 60,000 square feet. Up in Myrtle Beach, we have a relatively new facility that's about 1/3 of that size. And then we have a much smaller facility down in the Embassy area that services our southern partners. Again, here are the other partnerships that we have. So the little dark blue and teal colored grocery carts are representative of all of our food pantries. So again, as Nick mentioned, our food pantries do 90% of the lift. They are the ones who are really facing the community and that first, what we want people to think of as their first stop for food resources. Then after that, you'll see these little orange houses, and those are community partners. It's kind of a catch-all for senior centers, after school program sites. Some of them might be libraries that we've partnered with. So kind of a catch-all for community-based partnerships. And the little green graduation caps are schools that we partner with specifically. So not every school in our service area, of course, high in the sky, but all of the schools that we have current partnerships with, that could be providing after school meal service. It could be doing backpack buddies or school pantry or school market, or they might also host one of our mobile pop-up distributions that we do across the communities that we serve. I'm going to pull up this one next. So these little cute red Low Country Food Bank trucks represent all of the places where we do direct to client distribution. So again, this was all the locations that we've been to in the past year. And this is where our trucks pull up and we do that farmers market style distribution for the community, open to any and everyone who might need services. We really try to target these distributions in areas where we either don't have strong pantry representation, or our pantries might have limited hours in some of those communities, particularly in our rural areas. We have some pantries that might have wonderful distributions, but only do it once a month. So we try to come in and fill some of that gap as best as we can with the resources we have available. One of my favorite layers that we use to help, it's going to take a second to load here, but to help us to visualize the kind of ease of accessibility that our neighbors have is doing a drive time analysis. This is a really wonderful tool that ArcGIS allows us to employ. I'll drop down the key over here is not the greatest. It's kind of hard on the left to see the color differentiation. But if you look at the map itself, anywhere that's in these, I'll zoom in a little bit to Charleston County here, anywhere in the darker fuchsia color, if you will, is within a 5-minute drive time to a food pantry. So anyone that lives in that darkest color is 5 minutes or less to their closest food pantry. As it moves out to kind of that medium shade, that would be a 10-minute drive time. And then the lightest shade of pink is 20 minutes. So again, zooming out, looking at our whole service area, we've got some really substantial coverage, and that's what we want to see. We want to make sure that we're filling those gaps, closing those gaps as best as we can. There are some areas that people point out, like this kind of large looking hole that you might see that's actually the Ace Basin. So there's not a lot of folks living in that area. So there are some geographic nuances that we try to take into account when we're using the mapping tools as well. And then toggle these guys off. It's lagging a little bit right now. Where's my county lines? Come on. There we go. And then we're also able to overlay information that we get from different organizations, whether it might be the USDA. Feeding America has a research team that does a lot of data computation around food insecurity, especially throughout the pandemic. So we're able to take that information as well to really have a better understanding of what food insecurity looks like overall across our service area. So this layer here is our food insecure population. The key is over here on the left-hand side. So the closer we move towards that darkest red, the higher the population in that census tract. Forgive me, I didn't mention this is all broken down by census tracts, which in the past 2 years is something relatively new that we've been able to do to really look a little bit closer at the community level. In previous years, we really were only able to see the data at a county level, which doesn't help us to really identify those pockets of concentrated need. So using census tract data, though it doesn't always perfectly represent a community, it does allow us to take a closer look. And then from there, we can drill down even further with just boots on the ground, getting to know the communities that we are serving. And I'll zoom in a little bit more toward the city here as well. And one thing that we always keep in mind is that census tract lines are not real boundaries. So we might see a really highly concentrated census tract next to a census tract where there doesn't appear to be quite as much need. Same thing will happen when we're looking at where we're putting our resources. And so we always just keep in mind that people do travel over those lines. They're not hard and fast designated areas. We also have food insecurity rates. So this shows us the percentage of the population of folks who are at risk of facing food insecurity, heightened risk of facing food insecurity. So again, scales over on the left-hand side there. So going from 0 to about 5%, upwards of 20% in some areas. And what we're able to do is kind of overlay this with our impact data to see, are we putting enough food in the communities where we know folks need those resources? So using this information, we're able to kind of sit around that table, brainstorm when we're seeing gaps in service, and develop our strategies moving forward and really tailor them to very specific community needs. And this one, I believe we're going to try to update this layer this year with some new ACS data. This comes from, if you're not familiar with the American Community Survey, it's kind of like a subset of the census. It's done every year, but it's done on a much smaller scale. So it is, it's not maybe quite as representative, but we do know that there are some challenges with the most recent census that was done. So we're trying to rely a little bit more on the ACS data because it might be a little bit more representative, even though it's a smaller sample. But here we have life expectancy. So we've got, as you can see, and I know that this is a conversation that a lot of different organizations and community councils and committees are having, is the differences in life expectancy from one neighborhood to the next can vary so much, especially when we're looking at our more urban areas. You know, there's a lot more differentiation in those colors. So same scale as in previous layers, kind of the darker the shade of blue, the higher the life expectancy. And we've got the life expectancy average ranges over on the left-hand side as well. And we know that life expectancy is definitely a social, one of those social determinant of health factors that we want to be taking into consideration when we're thinking about how does lack of access to food impact health. Well, life expectancy is right up there as one of the biggest indicators. So obviously something that we want to be paying close attention to, definitely ties into the work that we are doing, and something that I think a lot of food banks are really starting to look at when we talk about those social determinants of health. And then this layer, I'm going to just toggle on. This is actually our meals per person in need. So this kind of shows us how many meals are we providing to each member of our community who has a need. So again, this is the past rolling 4 quarters about the past year. Darker the shade of green, the more meals we are putting in those communities. So this takes into account those food insecurity rates as well as our outputs, and shows us the impact that we're making in those census tracts. Again, this is a layer where that hard and fast line thing comes into play. Census tracts are not actual boundaries, so we know that folks are traveling from one area to another. And some of the areas where the meals per person in need are low are also areas where the people in need are low. So there may not be as many services available. For example, Daniel Island. We know that there's a higher prevalence of people living with a bit more affluence than our communities that are maybe a little bit more impoverished in certain parts of Daniel Island, I should say. And we don't have a lot of resources out that way, which kind of shows here is not a lot of meals were put out per person in need. But again, it's one of those nuances that we have to kind of keep in the back of our heads as we're doing our data analysis, really understanding the context of the communities that we're serving. So I could go on about this for hours, and I will save y'all from that. I definitely want to offer my services if ever anyone is interested in having a deeper discussion about the work that we're doing around mapping and how we're using it to drive our strategy and decision making. Nick and I are always open to that. But it's a wonderful tool that we're really trying to put to use, because we can only know so much from sitting behind our desks. Obviously, getting out in the community is the best way to know what the needs are, but this definitely helps us to start asking those right questions.
Thank you so much, Alicia and Nick. Great presentation. Any questions for Alicia and Nick on this? I wanted to ask you, I don't know if you work at all with the USDA. We have a sister city agreement with Doha, Qatar, and they recently came to the USDA. They're trying to figure out, they've got a little different problem in that a lot of their food has to be shipped in. They don't grow a lot of their own food currently, but they're looking at ways to do that. But one of the things that the USDA showed them was, and it's a public-private type partnership where they have these these shipping containers where they're growing their own food inside the shipping containers. And I don't know if that's anything that you guys had looked at as far as, as far as something you could use or not, but it seems like if you could get those shipping containers maybe in these rural areas or in these areas that are harder to get to. I don't know. It's just an idea. I don't know if you've looked at that at all.
Nick, do you want to take that one?
Yeah, no, let me have a go. It's a great idea. It's a wonderful idea. And it's actually an idea that we have been using in terms of the use of containers. We piloted a project about a year ago down in the southern part of our service area, whereby we have used containers, refrigerated containers. So we have adapted the containers with a refrigerated unit on them, which have been located with some of our key partner agencies, so some of our food pantries. And that has enabled them to be able to secure and hold fresh produce, perishable produce for longer periods of time, and enabled them to be able to spread their distribution to their neighbors over an extended period of time. So where they would have previously received food, not had the refrigerated infrastructure, would have had to have distributed at the same day that they received the food. So we've found significant improvement in being able to serve our neighbors in those counties in the south, with being able to enable those partner agencies to refrigerate fresh produce and perishable produce for a longer period of time. And we've seen significant uptake in the amount of food that then's been distributed out to communities in need. We're now extending that up into other counties as well, and looking at ways and means in which we can be more efficient and effective with having those refrigerated containers located in more rural areas that allows us to drop off more effectively from retail stores, for example. It reduces the amount of double handling that we have to do, but ultimately at the end of the day allows us to better serve communities. So that is definitely a technology that we've been piloting, and something as a technology that we are an innovation that we're actually sharing more broadly with the food bank network with Feeding America as well. So no, I think it's an absolutely great idea, and especially these days, I think with the large number of containers that are potentially coming into this country, the availability of containers is something that will potentially increase over time as well. So we can be pretty efficient in our ability to use this technology. And it's very appropriate. The cost of running one of these refrigerated containers is not high. Our agencies are saying it doesn't cost them much more because they can turn them on and off when they don't need to use them. So really appropriate technology, and something that we are expanding and using across our service area.
That's great, Nick. I do want you to understand what I was talking about. They're actually growing the food inside the containers. So,
So we do have a partner. I don't know, Kevin, if you're familiar with Vertical Roots. They're based out of Somerville. And so they do container and vertical growing. And so we receive a lot of donation, beautiful lettuce from them. I think right now we're definitely seeing that more with some of the growers that we're partnering with, a lot of the local guys specifically. And some of our bigger growers are starting to use that technology as well. But for us, I feel like we're not quite there for our agencies, but it's something I could definitely see us doing in the next decade or so.
Great. Very good. Any other questions for Nick and Alicia? Paul Wieters, please.
Hey, I just had a question on the slide where you provided where the drive was 5 to 20 minutes away from areas. Sure. And I was looking in the one area that just keeps popping in my mind is the West Ashley area around between really West Oak Forest Drive and Wapu Road, in that Ardmore area, where there are grocery stores within that 5 to 10 minute drive. My question is, does that map that y'all put out include how CARTA or the public transportation is helping with those drives for areas that maybe transportation isn't the easiest access for? That's what I was just wondering if public transportation is involved in that decision of how you mapped it out.
So the way that that ArcGIS does it, so it's one of the kind of functions of the mapping technology. So they actually map the drive time on the streets based on the speed limits and that sort of thing. So it doesn't, I'm sure it is accounted for in a way, but it may not accurately represent the time it might take if you're taking CARTA, including the stops and those sorts of things. But that's definitely something I can look more into public transportation routes specifically. This is a part of the technology that we are definitely novices in using, but that's a great question. And again, I should mention this layer is based on drive time to a food pantry. So grocery stores are not accounted for in this layer. It's specifically food pantries.
Okay. Thank you.
Great question, Paul.
Any other questions? Mayor Tecklenburg.
Thank you, Mr. Chairman. And Nick, I'm sorry I was a few minutes late, but thanks for all y'all do. And Alicia, that's an amazing amount of data there. I compliment y'all on the use of data in mapping all this out and figuring out your services. I think that's terrific. And it sounds like I was going to mention Vertical Roots, but that's who you're working with. I know the founder, if you need more connection with them. And Then lastly, I was going to ask, and this may be a follow-up conversation, Nick. I'm asking Laurie to give you a call. Apparently, I just found out yesterday, we have parts of our city where we have summer camps, and James Island is one of them, where the schools don't have a high enough percentage in kids to qualify for free lunch. And so apparently in the past, we used to get free lunch from the schools. They'd make them for our summer camps, but they're not going to be doing that on James Island. So we'd like to partner with you and your kitchen there, like a backpack buddy kind of thing for our summer camps, where we're not eligible any longer for those free services.
Yeah, no, that's fine. Absolutely. I mean, if as you say, if someone wants to reach out to me, we can certainly look at that and see what we can do to help on that. Mayor Tecklenburg, that's absolutely no. We just have the person reach out to me. We will certainly deal with that.
Great. God bless. Thank you.
Thanks.
Thanks for all y'all do.
Thank you very much. Thanks for your support as well.
Any other questions or comments on this?
Joey
Nick?
Current.
Oh, Joey, I'm sorry. I didn't see you.
Oh, that's okay. Hey, so everybody, Joey Current with Trident United Way. Nick and Alicia, you mentioned advocacy as one of the big pillars of work that you guys do. So I'm just curious if there are any major things on the advocacy front at the local level we should be aware of that you guys are wanting to focus on.
Yeah, well, certainly. I mean, we do a lot of local advocacy. I mean, one of the areas is obviously access to food sources. I mean, the SNAP benefits is something. Access to SNAP benefits is something that we are high as a priority for us in terms of advocacy, but also in terms of ensuring that people have access to information and are able to access that information effectively and efficiently, and to be able to access those additional types of support. But certainly that's a key area for us in terms of advocacy. But very much a lot of our advocacy is adding our voice to what others are doing, and adding to that as best we can with some of the experience and the data and the knowledge that we have based on the work that we do.
Okay, thank you. That's really helpful. Yeah, I think access to SNAP benefits is something that we can look at from like a health and all policy standpoint to see if there's ways that we can partner to continue to advocate that in that space.
If that would be great, because to be honest with you, I mean, we do run into some challenges in terms of finding the appropriate partners to be able to address some of those issues. I mean, we've tried to reach out to a number of different stakeholders that are dealing with that. And again, I think part of it is because everyone is so busy and has a lot to deal with at the moment. So that has been very challenging. But certainly if we could have a discussion on that and think about how best we can add our voice to that, and obviously anything that we can do to support that work around access to SNAP benefits, that would be really helpful.
Very good. Anyone else on this? Well, Nick and Alicia, thank you so much. Appreciate all the work that you do. We're very fortunate to have you in our area, obviously serving those 10 counties, and the incredible amount of work that you do. And we really appreciate all that you do, and appreciate your time here on this meeting as well. So thank you so much.
Thank you for having us.
Thanks ever so much for having us and allowing us the time. Really appreciate it.
Yes, sir. Thank you. All right. We'll move on to our community health update. If Dr. Katie Richardson would like to take over now. Thank you.
Thanks. I appreciate it. There's never a dull moment in public health. So there's lots of hot topics. And I think maybe the best thing is for me to just give a few lines about several of them, and then open it up for questions. So as we all likely know, our case rates are increasing in Charleston. We were one of 6 counties as of last week who moved from the low to the medium community level. That was based on our case rates. increasing over 200 per 100,000 for the week prior. That the guidance around being in that medium level does say that if residents are at high risk for severe disease, they should speak with their healthcare provider about whether they need to wear a mask and take other precautions. It also increases the guidance around staying up to date with COVID-19 vaccines, whether that's completing the primary series, getting the first booster, or for those 50 and over, or those who are immunocompromised, considering the second booster. And getting tested with any symptoms. And then lastly, if someone tests positive, they should speak to their doctor or other provider about treatment options. Paxlovid being one of the most common that is available, but it's available by prescription from your provider, from our FQHC, FEDER, and other clinics in the area, and at several pharmacies. So that's the guidance around increasing COVID cases. We've seen about a 77% increase in cases over the past month, and about a 53% increase in hospitalization. So we are continuing to follow that. We are not yet at the sort of next place we may see moving from medium to high is if our hospitalization rate increases to 10 or above per 100,000, and we're currently at 7. So we're not that far off. I do believe that it's time to start taking seriously again the rising number of cases in our communities. Please help us spread the word about that. In Charleston County, we do have 70% of our population fully vaccinated, those ages 5 and over who are eligible, and 45% have received their first booster if they are eligible. So there's really is a lot of room for improvement there. I think that's all I'll say about COVID. Moving on to SHAPE and some of our sexual health initiative work. We did have the opportunity to present at the Mayor's Commission on Homelessness and Affordable Housing quarterly meeting last week, and we were very grateful for that opportunity. We did discuss a new idea of having fast-track cities community chats throughout the Tri-County region, and we will begin in earnest sort of meetings to plan those as a way both to put sort of ending the HIV epidemic back on the priority list for public health, and to educate the community around HIV and some of the intersections, for instance, with homelessness, and also to be able to bring sort of more community members and community leaders into these discussions about what steps we should take moving forward. We also have the opportunity through the Fast Track Cities to present some of the work we did around U equals U, which is untransmittable equals undetectable. An untransmittable viral load equals an undetectable viral load equals a person who is not able to transmit the virus to someone else. And we had the Future is You campaign, billboards along I-26 and 526. There's also a website, thefutureisyou.org, and we will be presenting that at an international Fast Track Cities conference this fall. So some excitement there. I also just want to mention the avian flu in the vultures in West Ashley that has occurred in recent weeks. That is some of those vultures did test positive for avian flu, and our guidance, which did go out in a press release, and there's information on our website, is that both people as well as pets should stay away from any dead birds. The risk is low for transmission of the avian flu to people, but please do not interact with those birds. South Carolina DNR is available for reporting of information about large groups of birds who may be dying off. And then finally, I just wanted to mention monkeypox. That is a pox virus. Similar to smallpox, we've seen now 15 cases in the U.S. across 8 states, not in South Carolina yet, about 584 cases worldwide. So again, I think low risk for becoming a pandemic, but certainly an outbreak that we want providers and the public to be aware of. If they are having a concerning rash and they've been exposed to someone with a similar rash, then they should seek guidance from their provider. If any providers are concerned or suspect monkeypox, please get in touch with DHEC and we will walk you through next steps from that point in time. I think that's, I'll stop there and be happy to take any questions.
Paul?
Yeah, Katie, the COVID is popping up. Is this the new strand that we're seeing, or is it enough to test yet?
It is still Omicron. There are several of the variants of Omicron that we're seeing. MUSC is really still putting out some of the best data around variants because they're doing, encouraging many in their community to do PCR testing. We're only able to do the sequencing on PCR test. And so they have that information on their website, on their COVID intelligence reports. So yes, it's still mostly Omicron, but some of the subvariants.
Any other questions? Well, thank you, Dr. Richardson.
Absolutely.
Appreciate
Thank
that.
you.
Thank you very much. All right. And
Kevin, before
yes,
we
sir.
go, Katie, could you just go over again what CDC recommendations are for cases?
For COVID cases?
Yes.
Yes. So if someone tests positive for COVID-19 on a rapid antigen or a PCR test, the guidance is still to isolate for 5 days. And then if symptoms are greatly improved, for masking on days 6 through 10 if going out in public. We also encourage the notification of any close contacts, and the close contact definition has not changed. That's still within 6 feet for 15 minutes or more per day during the several days prior to symptom onset or diagnosis, along with the time of isolation. And then again, speaking to your provider about whether treatment options may be right for you.
And adding on that question, the quarantine, if you're not boosted, you're having to do 5 days of quarantine versus if you're boosted, you're excused from that 5 days of quarantine if you're asymptomatic.
That is, yes. I don't have it in front of me. I'm pretty sure that is still the case. Certainly with any symptoms, we do recommend testing. And even if asymptomatic, we recommend consideration of testing at that day 5. But for those who've had there's another qualifier there. If you've had a recent infection, also quarantine is not indicated. So fully vaccinated or a recent infection, still watch out for symptoms, take precautions to protect those who you may be around, particularly those at higher risk. But if no recent infection and not fully vaccinated, yes, quarantine is still recommended.
But masking is required regardless whether you're vaccinated or not if you're a close contact.
Masking is recommended, yes. if you're a close contact, because certainly we continue to see cases in people who are vaccinated as well as unvaccinated. Thankfully, what we're seeing is generally mild cases in those who are vaccinated. And but it is still possible to contract COVID and certainly to transmit it, even with prior infection or with vaccination.
Very good. Any other questions for Dr. Richardson? Thank you very much. Oh, Mayor Tecklenburg.
Not really a question, but I guess by way of testimonial, I'll say that this thing really is contagious incredibly, as you all know. And I've been in the basement of the doghouse for bringing it home and infecting my wife. And then I got blamed for everybody else in the family, but I didn't even see them. I wasn't around. My brother Paul got it. My brother Fred and his wife got it. My granddaughter and daughter got it. Joseph came down with it yesterday. I wasn't around them, but it seems like my whole family in the last 2 weeks has been COVID, but thankfully everybody's been mild and all like that. But I don't think DHEC's numbers reflects all these cases that are running around right now. It is really out there, y'all.
It is, and DHEC's numbers do not reflect it because we do not, at-home rapid tests are not reportable to DHEC. So we are following the trends, but the absolute case number is absolutely much higher in the community than what's reflected in our numbers.
Thank you.
Thank you, Dr. Richardson. We're so fortunate to have you on this committee and helping us out, and appreciate all of your information, your expertise. So thank you so much. And we'll move on to community updates. Mayor Tecklenburg, not to put you on the spot, but I know that there's been some gun violence situations recently, and that certainly fits in with this committee. If you wanted to say something, I wanted to give you that opportunity for you or Councilman Seekings, on the recent issues.
Well, I would just share, and I think everybody on this call knows this, that gun violence is not just a public safety matter and hazard. It's a public health hazard at this point. And I was messing with the numbers yesterday as we had the incident night before last, particularly with mass shootings, which is defined as 4 people being either shot or killed, but even just shot qualifies according to the way they track the numbers. And this year in the United States, there have been 230 reported mass shootings, and that equates to 1 every 16 hours. And of course, much more frequent for individual gun violence. I think it's like 1 a minute or something crazy like that in the country. But I mean, this thing is out of control. I mean, it's like the country's gone bonkers with gun violence and the how quick to the draw folks are to resolve petty differences by or making statements by brandishing and pulling out and using their weapons, and the availability is just horrendous in my opinion, and it's such a confounding situation for a city government in a state where we have virtually no authority whatsoever, on the legal side, and then the state legislature, it doesn't even give us reasonable tools to arrest. And well, we can arrest, but there's really no big penalties for repeat offenses for carrying an illegal gun or using an illegal gun. It's mind-bending that quote liberals and conservatives can't agree, at least on the criminal element of having meaningful penalties when not legal, but when illegal guns are possessed and utilized. It just blows my mind, really. Anyway, I don't mean to be a complainer, but it's a confounding problem, and it's going to take a lot more work and a lot more energy, and a lot of people saying they're fed up and had enough to make some change happen on this. We need some reasonable change to help avert some of this these deaths and this gun violence that's going on in America. It's not just Charleston, North Charleston. It's all over the country.
Thank you, Mayor Teckenberg. Appreciate that.
Yes, sir.
And, I think Jennifer Roberts may have wanted to share some things.
Yeah, thank you. I'll be fast since it's 10 o'clock. I did want to mention our conference is coming up in July, and thank you, Mayor Tecklenburg, for doing the press conference for that. I won't go into detail, but I'll keep sending you the link to the 3-day conference, the 27th, 28th, and 29th of July. It is our 10th annual, and it's going to be, we have lots of entertainment this year, and a lot of our best speakers coming back and doing different talks than they've done before. So I think it's 15.25 CEUs. And then also for Piccolo Spoleto, if anybody's out with their family or friends, we are doing the Art of Discovery exhibit again at the Circular Church. We kicked it off this past weekend, and it's artwork from kids from all over Charleston and some neighboring counties, some mostly high schools, but not completely. And the art's really beautiful again this year. And some of the kids are selling artwork. We weren't doing that last year, so please stop in the Circular Church. It's 11 to 7 every day, and it runs till June 12th.
Thank you very much. Any questions on that? Anyone else with community update? Anyone else would like to give an update? Well, seeing none, I do just want to remind everyone that we've got a June primary coming up. It's an important time to vote, so I hope you'll get out there and do that. I did my early voting yesterday. Well, man, it was quick and easy and very simple. I mean, you got the early vote available to you. I would recommend it, but certainly want to wish the very best in the primary to Dr. Andrews on her run for Congress as well. She's been a long time member of this committee, and certainly wish her the very best. And just want to remind you that in Charleston in the summer, if you're not barefoot or in flip-flops, you're overdressed. So I hope each of you will find some time to enjoy the beaches, parks, pools, rivers, and hope you have a fantastic June. If there's nothing else, we stand adjourned.
Thank you, sir. Thank you, everybody.
Thank you.
Great. Thanks, everyone.
Have a good evening.